Hi there. Welcome to Kootenai Health's Total Joint Program. My name is Lori Moorhead. I've been with the Ortho Neuro Department for about 8 years now. I do want to thank you for joining this program today. I have seen over the years that people who attend the Total Joint Program do know what to expect with the program and tend to have a really good recovery because they know the expectations and do very well with our program. So thank you again for attending. Our class goals today will be to understand what to expect before, during, and after surgery, to know what tasks you need to complete to be able to go home, and to answer any questions about your upcoming surgery. So our program, we want you to be an active member in your recovery. You will have a family or coach that we are asking to help prepare you in your recovery. They will be helping you. They won't be doing everything. So we do want you to be actively doing your exercises and the recommendations that we give you. This will help in your recovery and aid you in getting better quicker. We also will be trying to achieve good pain control. It's important for healing. It allows you to be able to do the things that you need to do in order to get better. We want to make your stay with us as pleasant and as relaxed as possible. Our goal is for you to safely go home as soon as possible after surgery, of course, and we want you to be prepared and confident once you do make that transition to home. The steps to success start before surgery. So you will attend a pre-op appointment with your surgeon or the physician assistant, and that will happen 1 to 2 weeks before surgery. You'll attend the total joint class, which is where we are now, and you will arrange for help at home and transportation after you get home. In the hospital, you'll have the surgery here at Kootenai Health. You'll have a short stay after surgery, and then we'll get you discharged to home once the expectations and recommendations have been met. After you go home, you'll attend outpatient physical therapy, and we suggest that you get that set up so it is ready and in effect by the time you leave here, and then you'll follow up with your surgeon as directed. So in preparing for surgery, it starts before you actually even arrive at the hospital. You want to be eating a healthy, well-balanced diet, reducing or quitting smoking and drinking alcohol. You want to arrange for help at home, so this would be your coach or family member. You want to look around your house about your activities of daily living. So your bathroom, is your toilet, does it have a nice clear walkway to where you can get to your toilet or your shower? Does the toilet seat in your bathroom, is it really low? Will you need a toilet riser to have it a little bit higher until you recover completely from the surgery? Do you have grab bars? Do you have rugs that are on the floor that you would need to pick up in order for a walker to safely go over that without a tripping hazard? So you want to look around your house and make sure that you've made it as easy as possible and as safe as possible to get to where you need to go, to the kitchen, to the bathroom, to your bedroom. Also, if you are still working, you want to make sure that you have the adequate time taken off for work. If you have a home with multiple steps or levels, you want to make sure that you let the physical therapist know that so that they can work with you prior to you leaving to make sure that you can safely go up and down steps. You'll want transportation to and from the hospital and for your follow-up appointments and to outpatient therapy. Your medications, if you see pages 31 and 32 in your total joint binder, You will be keeping your home medications at home. We will supply those for you here. And we'll go over the medications that you should take prior to your surgery. You want to make sure that you're having regular bowel movements. If any of you have taken pain medications, you know that pain medications chronically cause constipation. It's a side effect of that medication. So if you have a bowel regimen that you're using right now that's helping, go ahead and continue with that. And we will give you some medications here as well to help with your bowels, but you want to make sure that you're having them regularly. As far as a dental checkup, the physicians will let you know if you need to have one prior to surgery. They just want to make sure that there are no sources of infection since you will have a new joint. We want to make sure that we minimize the risks of getting an infection, and your mouth and dental areas are a source of infection, so you want to make sure that you're all cleared up with that. So dental checkups before and after are important. You want to avoid shaving for 48 hours before the procedure as well. So what to bring to the hospital? You want your total joint program binder. You want to bring that with you. It has exercises in it that the physical therapist will be circling and telling you how many they want you to do and things like that. There's also a lot of information in there that you can refer to throughout your stay at the hospital regarding the program. You want to bring 2 to 3 changes of clothes. Make sure those are loose fitting and comfortable. So for instance, sweats or maybe some basketball shorts for the men would be helpful. You will have some swelling, so you do want to make sure that it is loose fitting. We have non-slip socks that we will give you here in the hospital, but if you wanted to bring along with you some non-skid slippers and some shoes with backs on them and socks, the occupational therapist will work with you on how to put on your shoes and socks in a way that will be helpful after surgery. As far as your personal items, please leave jewelry and money and your wallets at home. If you wanted to bring your insurance card and your identification the morning of, and you can give that to your coach or your family member that brings you, that would be fine. But please do leave your jewelry and money at home. And if you need any equipment overnight, for instance, a CPAP, go ahead and bring that. You will want to bring your walker in. And we do suggest that you have a front-wheeled walker, not a four-wheeled walker. The front-wheeled walkers are a little more stable for people who've had surgery. They don't get away from you as much as a four-wheeled walker would. So bring that with you, and we can make sure that with the therapist that it is at a good height and that it's a good walker for you. Please do not bring your home medications to the hospital unless you're told to otherwise. People that you will see in the hospital, you'll see a surgeon and their physician assistant or a nurse practitioner. You'll of course see anesthesia, an orthopedic navigator, nurse practitioner. You'll see probably in the morning after your surgery. That person will come by and check on your incision, make sure your pain's under control, make sure your nausea is under control, labs are good, things like that, just to make sure you're on the right road to be able to go home that day. You'll of course be talking with nursing. Please make sure that you have good communication with them regarding your pain, nausea, anything that's going on with you. Physical and occupational therapy will come in and work with you and get you cleared for home after meeting certain requirements. You may or may not see pharmacy when you come, depending on the medications that you take. And then you'll, of course, see transitional care services that will help with the discharge piece. This is a pain scale, and you'll be referred to this several times throughout your stay with us. And this is just so we can have an overall view of what your pain is like. While you're here, your expectations of pain management, we're going to want the lowest dose of pain medication to be used to achieve pain control. And what we're going to do is we're going to help you set a resting pain goal. And usually that's between a 3 and a 5, depending on your pain history. But the resting pain goal is something that we're going to be working towards with the pain medication that we have. So it's normal for your pain to increase with movement. So we're going to set a resting pain goal, and then when you move around, such as with physical therapy or going to the bathroom or something, your pain is going to increase by about 2 or 3 points during that time. After the 30 minutes of rest, though, once you get back to that resting position, your pain should start to return to a normal level. If it is not at that time, then we of course want to adjust your pain medications, or see if we need to give you a dose of pain medication at that time. You may be woken up during the night, and it might seem kind of crazy to wake you up in the middle of the night to ask you how your pain is. But the reason that we do that is because we don't want you to wake up in the morning and not have had pain medications all night long, and you wake up and you're in pretty excruciating pain, and you're not going to want to work with therapies, you're not going to want to get up and go to the bathroom. We do want to make sure that your pain is actually controlled throughout the night. We don't want to have to chase your medication and try and get it back to goal. So we want to keep it at a pretty even level. So we do wake you up during the night and we ask you about that pain medication. And I suggest that maybe for the first 2-3 days that you set an alarm clock at home and wake yourself up and take some pain medication as well if you're having some pain. Also, we may decrease some of your medications like narcotics if you have an unsafe reaction, which would be just a confusion, or you're too sleepy, too fatigued to get up and work with therapies. So we will be monitoring that as well. We use a multimodal pain management system, so we use a combination of treatments to have good pain relief. We use different kinds of medications. For instance, we could use a tramadol Tylenol as a scheduled dose, and then we use a narcotic such as oxycodone for breakthrough pain or as an as-needed medication. So if the Tylenol and tramadol are not covering you sufficiently, it could be different for each person, so that is just an example of our multimodal pain management. We could use nerve blocks also. That's done during surgery. And those wear off eventually though, so we do try and get you your pain managed with oral medications. We also use cold therapy, so ice. That helps with swelling, which also will help with pain management relief. We do like to use all types of oral pain medication. However, you might have a little bit of IV medication right after your surgery, just to get the pain under control. But we use those in small amounts and for not a very long time. We want to manage your pain orally, so that way we know that when you go home that you have a pain plan in place with oral pain medications. So the day before surgery, you're not going to eat after 11 p.m. This will include chewing tobacco, coffee, and gum on the morning of your surgery. Your surgery could be canceled if you do eat anything after 11 p.m. So please be mindful of that. You may drink water up to 3 hours before you arrive to the hospital. So a little sip of water before you, if you take your medications prior to coming in. You want to have a bowel movement if possible. You will be showering the night before with Hibiclens or CHG, chlorhexidine wipes. This will help with the antibacterial, so it cleans off your skin. You'll want to pat dry with a clean towel wear clean clothes and put clean linen on your bed. And then the next morning you will not shower the morning before surgery. So you'll keep that chlorhexidine or the HIPAA on still. The day of surgery, you'll want to make sure that you grab your total joint binder and bring that in with your clothing that you're bringing in. It's okay to take your pain medications prescribed by your surgeon the day of your surgery. If you're a diabetic, you're going to continue your long-acting insulin, but not the short. And then you take your blood pressure medication if applicable and if advised by your surgeon. And then make sure that you check in on time. Surgical time is between 3 and 4 hours, and that includes time in recovery. The surgeon will find your family or your significant other, your coach, in the waiting room to give them an update. And then as soon as you arrive on our floor and we get you tucked in, then your family or coach can come in and come into the room with you. The following tasks are going to need to be done before you go home. So we want to make sure that you're eating food without getting sick. Sometimes anesthesia can cause people to be a little nauseous. We do have medications for that to help with it. So please be in communication with your nurse if you're not feeling very good and you don't, you feel nauseous, and we can get you something for that. We want to make sure that you're passing gas if you're discharged within 48 hours. So when you have anesthesia, it kind of shuts everything down for a little bit. So we want to make sure that everything's running well, and that everything's woken up, and that your bowels will start working. So we want to make sure you're passing gas, and if you're here longer than 48 hours, we would want you to have a bowel movement. We want to make sure that you're urinating without trouble. That you understand the pain management plan, so when you go home, you know exactly what you need to take and how to take it, and to help with that pain, and that you're cleared by physical and occupational therapy. They will have you getting up out of the bed, sitting in a chair, and walking, and possible stairs if you have stairs in your house. Some things that you might see here, there's the picture that's on the PowerPoint right now is called an incentive spirometer. This is going to help you not develop a pneumonia. So the goal in using one of these, and this will be explained when you're in your room also by your nurse, but you want to breathe in nice and deep so you can open up those lungs. After surgery, you could have a complication of pneumonia, so we want to make sure that we avoid that. So using this will help, and also getting up and walking around is going to help with that complication as well. You may see some white compression devices that are around your calves, and this is going to help with circulation throughout your body. Another complication could be a blood clot, so we want to make sure that you have good circulation coming from your legs all the way to your heart. So we put on these things called compression devices, and what they do is basically just massage that blood from your legs and just push it up throughout the rest of your body. You may or may not have a drain that comes out too. If you do have that drain, we'll be monitoring the output that comes out of it, and as soon as it stops having a certain amount of output in it, then we'll remove that, and then you'll be able to go home, but you will not go home with the drain. You may have a urinary catheter, but that's very rare. If you do have one, we try and get those out as soon as possible. We want you to get up and use the bathroom, and urinary catheters can be a source of infection, so we want those out as quickly as possible. And you'll be on blood thinning medications, and we'll go over that in a few minutes. So potential complications, we also kind of talked about nausea and vomiting. So we will be treating that if you have the nausea or vomiting. Infection is also a possible complication, and we're doing things proactively to avoid that from happening, and that would be the antibacterial wipes, You will receive a antibiotic prior to your surgery as well. Pneumonia would be a complication, and we'll be having you use that incentive spirometer that we just talked about, and then we'll get you up and moving around so you're breathing and avoiding that pneumonia. Constipation would be a complication. We want to make sure that you stay hydrated, so drink lots of water. Use the stool softeners that are prescribed to you. Uncontrolled pain could be a complication, and like we have talked about, we're going to make sure that we have a pain plan in place before you go home. So we want that consistent pain management for you prior to your return to your home. Blood clots are also a possible complication, and we're doing things prophylactically for that as well. The compression devices that we put on your calves, those will help. And then you also will be put on a blood thinner. Most of the time it's aspirin at the full strength aspirin 325s twice a day, but you might be on something called Lovenox, and that's a little shot that we put into your stomach, and that's done on a daily basis. Or if you are already on like a Coumadin or other blood thinner, you might just be placed back on that medication. So it all depends on your medications that you take already. So the after surgery, you have a kind of a timeline. So weeks 1 and 2, you want to spend most of your time recovering from surgery and rehabilitating. You're going to be using your coach for help in your recovery time. You're going to be working on pain management, getting up and moving around. I suggest to my patients that I've had in the past that we want you to get up about every hour to an hour and a half and just take a little walk around your house. The short little walks are much better than the longer ones, but you want to do them frequently. So about every hour to an hour and a half, get up, walk to your kitchen, walk around your house, just do something to get that joint moving. It's actually going to help with your pain control and your recovery. Weeks 2 through 4, you're going to be progressing to where you're probably able to go out of the house for short to intermediate trips. You don't want really super long ones, but you will be able to go out of the house and enjoy some fresh air and taking some short trips. Weeks 4 to 6, you should be feeling much better, needing very little help with your care, and returning to your normal activities of daily living. And then at 3 months, most patients have returned to normal life and activities as allowed by your surgeon. And you can refer to page 24 in your binder for more information about that. I do want to make mention that when you get home, after your surgery, you will have swelling and you will have bruising. So don't be alarmed if your limb is purpley and swollen. Those are all normal signs after surgery that will go away. You want to make sure that you are doing your walking and that you're keeping the limb elevated when you're sitting and keeping ice on that area. So those will all help with the swelling. But just be mindful that the bruising is normal, so that you can expect that. That is it for my portion, and we will have the discharge planner here to talk to you in just a moment.
Okay. Hi, I'm the case manager. I have to think about it now. Can you rewind it a little? My name is Sandy. I am a case manager, and my role is to help you to be able to get home after you have your surgery. I try to meet with patients before they have their surgery so we can get everything prearranged. And I just want to tell you a little bit about my background. I started working with total joints in 2008 in a different facility. Later on, I went to work in an inpatient rehab facility that was adjacent to our hospital. So I understand the rules about total joints going into rehab, that's not really appropriate discharge location for you. You are coming in for an elective procedure. You're strong and healthy, and we want you to be able to get stronger and be able to go home and regain a lot of that life back that you've lost. I have some resources that I wanted to share with you. I have a list of locations where you can get equipment. Everybody is going to need a front wheel walker, and what that means is it has 2 wheels on the front and just stubs on the back. Sometimes people put tennis balls on those back stubs to help slide across the floor easier. Those are the same walkers. You can get those in lots of different locations, and I have resources to help you be able to find some of those. If you are a veteran, there's a special place that you can get those in a secondhand store that's in Post Falls that is set up just for vets. And also many of the VFWs have loaner closets. My contact information will be provided to you. If you have trouble finding equipment, you can call me and we can go ahead and get you some information on where to find things. So to discharge home, so you probably have already heard that every patient needs to have a coach. The coach is that person that helps to support you with remembering what time you took your medication, maybe standing by you as you walk to your bathroom for the first few times, sitting outside the door when you take that first shower, things like that. They're not there to wait on you, they're there to support you and to help you if you just need some reminders on doing your exercises and different things like that. So before you come into the hospital, everybody needs to have the coach already established, and we need to know who is going to take you home. Most of you will spend that first night in the hospital and go home the following morning, so it's best that we have all that information before you have your surgery. The next thing I need you to do is to find an outpatient therapy company that is close to your home and convenient to you in your life. I always recommend that the patient find that because it's easier for you to find some place that is just convenient. If I was to look for a place, you might not like where I send you. You need to look at the binder that you got from the doctor's office and look at the equipment that you're going to need. It's going to be different based on if you're having a total hip or a total knee. So make sure that you review through that, and once again, that's something that you can call me and ask me questions about if you have any questions. The avoid lifted vehicles for discharge refers to the really high jacked up vehicles. Very difficult for us to be able to assist you to get back into one of those vehicles after you've had a total joint. So we recommend you don't have your driver come in one of those. What I do recommend, though, is that you bring a giant black garbage bag and put it on the seat so that you can slide into the seat easier. You can sit in the front seat or back seat. It doesn't make a difference as long as you can be safe, and that bag will really help. For preparing for home for safety, now is the time to go through that binder. You should go through it 2 or 3 times, really know every single page of what it is describing. There's been a lot of effort that has gone through to make that binder very supportive for all of our total joint patients at Kootenai. Now is the time to make sure that your walker will fit through the bathroom door, that your shower is safe. If you need to have any handrails put in, we don't recommend the suction type. We would like you to go ahead and have those that are screwed in. Whatever you need to do to prepare. Preparing your home for safety is what all of us would like to do if we could come into your homes, but we can't. So that is really important that you just do some cues, walking through, just making sure that everything is going to be good for you. The last thing I want to recommend to you is that if you have a pet or something that's going to be in your house when you first come home, if you could just have your family member put that pet into a different room, block them off so that you can actually get in and sit down in your chair before you come in, so that they don't trip, before they come out, so that they don't trip you. We have been working really difficult, really We have been working very diligently on a process that we call same-day discharge. And what that means is a patient would come into the hospital, have their surgery, and then we would discharge you home from a recovery room. It's a process that we were doing a few months ago, and then we paused it because we wanted to really make sure that we had everything in order for the patient to safely be able to go home. All the staff needed to be educated. We needed to make sure that we had all those pieces in place for you. So if your doctor talks about you going home for a same-day discharge, you're going to make sure that you bring your walker to the hospital, which you'll need to bring your walker to the hospital whether you're a same-day discharge or you're going to spend the night. You need to make sure that you have a coach that's going to be with you. You've probably heard a lot about coaches already. I don't have to go into that any further. You're going to need to complete the pre-op exercises that are in the book. What's important about that is that you know what those exercises are, so that when the therapists see you in the recovery room, you can easily do them. Every patient will have a medication placed into their muscles that will help everything be sleeping so the doctor can do the surgery. We're going to need to have all those muscles wake up so that we can help you to stand, get in and out of a car, and different things like that. So before you're able to go home, we'll need you to pass the nurse's checklist for safety, and we'll need you to pass the therapy checklist for safety. Not every patient will qualify for the same-day discharge process. It's something that you would definitely discuss with your physician, and we have to have a really good, solid plan for you before that happens. For a patient to same-day discharge, we would want you to have your outpatient therapy set up, and we look forward to seeing you.
Hello, today I'll be talking to you about the therapy and equipment portion of the total joint course. First, in preparation for your surgery, we'll go over we'll be talking about the different purposes of occupational and physical therapy. Our main focus is to make sure that you are safe for return home and have all the education you need regarding movement patterns, limitations to your mobility, and ways to improve your safety. On your first day, we will go over the goals for discharge home, including getting in and out of bed, having good standing balance, getting in and out of a chair, on and off the toilet. If you're going to be going to outpatient physical therapy, being able to walk about 300 feet. If you're going to be having home health physical therapy, 50 feet so you can accomplish household distances. We'll also want to see you be able to do your stairs, how you would do them at home, depending on what rail setup you have and how many you have. We also like to see you be able to get in and out of a car, however your personal vehicle setup is, in and out of a shower or a tub, being able to get dressed, using adaptive equipment to do those things if needed, going over all of your precautions, and making sure you're overall just moving well enough to go home. A large portion will be going over your home exercise program to ensure that you maintain your mobility until your outpatient therapy follow-up. On the day of your surgery, we will be coming to see you, so don't be surprised. It is the gold standard to get you up and moving the same day. Sometimes we'll come see you while you're still in the PACU, but most of the time we will see you after you have been moved onto the floor. And discharge will be addressed day one, although we will make recommendations at the end of the session based on how you're moving and what you still need to complete to be home safely. Physical therapy, we focus on walking, balance, stairs, car transfers, getting in and out of bed, and exercises to ensure you have optimal home safety. Occupational therapy further refines those skills to apply them to your daily tasks, including getting dressed, your hygiene, also being able to get in and out of bed, on and off the toilet, cooking, cleaning, those kind of things. Most patients will be weight bearing as tolerated after surgery, but occasionally there are adjustments to that if needed. If there are any precautions to your weight bearing, we will go over that and review alternative movement patterns to optimize your independence. When you come to this hospital for your surgery, please be sure to bring your joint binder, as we'll fill out the exercise portion with how many you want to be able to do, and we'll go over how often. We would like to encourage you to be up to the chair for all meals and taking walks, whether it be with therapy or with nursing after your surgery, to encourage consistent mobility for your recovery. Something to consider if you're having a total knee replacement, we will tell you that you cannot place a pillow under your knee, and your bed in the hospital will be locked into a flat position on the lower portion of the bed to prevent you from bending your knee. It is very crucial that we don't rest for long periods of time with your knee bent, as it can literally get stuck that way and will not be fun later with your outpatient physical therapy. Next, we'll go over the exercises. The first 7 are for both total hip and total knee replacement. The last 4 are for total knees only. We will go over each of these on day 1 and the second day, most likely, if you're still here, and your outpatient physical therapist will progress on to more difficult exercises or more challenging versions of these ones. The first one is for upper body strengthening to help encourage increased endurance using a front wheel walker after your surgery. It is an armchair push-up, so your hands are going to stay in contact with the arms of the chair at all times, so you're not going to come to a full standing position. Next, we have the exercises for both total knee and total joint replacements. Possibly the most important of all these exercises are ankle pumps. These help prevent you from developing clots in your calves and your legs while you're moving around a lot less than normal, and it also helps maintain swelling. Next are quad sets. Essentially what you'll be doing with the straight leg is pushing down into the bed with your knee, trying to contract your thigh muscle. Next, we have the glute sets. Similar to the quad sets, you're going to be squeezing your buns and trying to get those muscles turning on after the surgery. Heel slides encourage increased hip flexion and knee flexion to help with bed mobility, lifting your leg in and out of bed, stepping over a curb, over the edge of a tub. That way we can work on getting those transfers down. Next are short arc quads. You can use a towel, a bolster, a coffee can. The focus is on, again, squeezing those thigh muscles to get them turning on. This one's also similar to that. It is just a larger range of motion. Now we have some exercises only for those of you who will be having a total knee replacement. First one is a straight leg raise. With a leg that is out straight, you lift it straight up in the air. You don't have to raise it very high, and we don't want to twerk your back or anything, so bending up the other knee helps keep your pelvis in a safe position for your back. Next, we have snow angels, which is with one leg, scooting your heel in and out to the side. This helps get some of the lateral hip muscles turning on post-surgery. Next is passive knee extension, placing a towel roll underneath your ankle, letting gravity do its job, getting that knee more straight. This one is a seated knee flexion stretch. You'll pull your heel underneath you as far as possible, and then you'll lean forward and scoot your weight forward to help encourage an increased bend in your knee. We'll go over exact amounts and frequency of when to do these exercises dependent on your mobility and pain levels the day of your surgery. Practicing these before your surgery and getting familiar with how they feel will be beneficial. Aquatic exercise is a great tool to have in your recovery package, although it might not be something you do until after that incision has fully healed. On the day of or after your surgery, we will go over stair training, depending on how your home setup is. If we need to use crutches or a cane to compensate for not having a rail, or to give you increased balance and support, we can. Going up the stairs, we'll have you go up with your good leg first, as it lifts you and your entire body against gravity. And going down, we'll lead with the bad leg, as the leg behind has to lower you down. Always use a rail if one is available. And then again, like I said, using a cane, even a crutch, we can do if needed. If you bring your coach with you after your surgery, we can have them assist us and teach them how to most safely complete stairs. Some different pieces of equipment that we will recommend and go over with you are the front wheel walker. We have photos of these later. A reacher, sock aid, long-handled shoehorn or sponge can help with donning clothing and socks, especially when you have to bend forward. Bedside commode or toilet riser increases your independence with getting off of a lower toilet, especially if you don't have grab bars or a counter to help. A shower, chair, or tub transfer bench is recommended because your balance is going to be off, let alone when you're standing in a slippery surface. On the left, we have a picture of a front wheel walker. If you get one before your surgery and bring it in, we can adjust it to your height and teach you how to use it. We also have a picture of a cane on the right, which can be helpful for stair training. Again, these can be helpful for dressing and cleansing. First is a picture of a reacher. The little nub on the far left top end can be helpful for getting socks off. Long-handled bath sponge is helpful for making sure you get your feet clean, especially if you're avoiding bending over far because it is going to be a little more painful. Next is a sock aid and a long-handled shoehorn, again helping with getting socks and shoes on. Your occupational therapist will go over how to use these devices if they think they will be good for you. If you are already having trouble getting on and off the toilet, you may want to think about getting a bedside commode or a toilet riser before your surgery versus after your surgery. That way you can get familiar using it. Here's a picture of a bedside commode. The bucket underneath does come out, so it can double as a toilet riser if you need both options. Here's a raised toilet seat. That black dial in the front is a clamp that just clamps onto the toilet bowl. If you are currently having trouble in the showers or your balance is already off, having a tub transfer bench or a shower bench will be optimal to ensure you don't have any falls. Your occupational therapist will show you some different versions of these to help determine what will be best for your situation. First is a tub transfer bench, and second we have a shower stool. The shower stool does also have a back on it if support is needed. Generally, equipment is not covered by insurance, so that is going to be dependent on what insurance you have. Case management can help and assist in determining different options with your insurance. We also have a list at the back of your binder of places that you can purchase new or used equipment. It is highly recommended for you to have your equipment before surgery. That way you're familiar with it and we can make it adjusted to your height. Other stuff that will be helpful in your recovery, having a handheld shower, especially if you are going to be sitting down to bathe. Grab bars in the showers. We do recommend the clamp-on grab bars versus the suction cup grab bars, as they are known to come off. A leg lifter can help getting in and out of bed. So can doing more of your exercises. And a non-skid bath mat is a good idea now and later. Although this is the first step in your recovery, you will have a long road ahead of you getting back to normal. Outpatient physical therapy will be helpful in teasing out all of those little movement patterns that you had developed to avoid pain leading up to this point. But it will all be worth it. Thank you.